When people ask me, Dr. Goldberg, how do you know when it's really time for a hip replacement? They're just not asking about surgery. They're asking if life can get back to normal again. Because when your hip hurts, it's not just pain, it's limitation. It's the loss of simple things that once defined your independence. Walking through the airport without limping, sleeping through the night, playing golf, or even picking up your grandkids. I've seen this story play out thousands of times over my 25 years as an orthopedic surgeon. And I can tell you, when you're at that point, you're not just living with hip pain, you're living around it. I'm Dr. Tyler Goldberg, an orthopedic surgeon based in Austin, Texas, specializing in concierge hip and knee replacement. And for the last 25 years and 12,000 surgeries, I've seen patients literally transform physically and mentally. I'm on a mission to transform the way the world experiences joint replacement. Ready? Let's hit it. My mission is simple: to free you from the limitations that hip and knee pain create and give you your movement, your confidence, and your life back. So today, let's talk about when it's really time to consider a total hip replacement and why, for the right patient, it can be one of the most transformational surgeries in medicine. In fact, did you know that a total hip replacement is actually the #1 treatment there is for customer/patient satisfaction there is in all of medicine? That's why it's often referred to as the operation of the century. Section 1, what's actually going on inside the hip? Let's start with what's happening beneath the surface. Most hip replacements are performed for osteoarthritis, what we often call wear and tear arthritis. Over time, the smooth cartilage that cushions your hip joint wears away. When that happens, bone begins to rub directly on bone. This causes pain, stiffness, and loss of motion. Why we get it is really anybody's guess. Sometimes it's genetic. Sometimes it's the result of trauma or injury. Sometimes it's from avascular necrosis, where the blood flow to the hip literally is compromised, causing the ball of the hip to collapse. In some cases, inflammatory conditions like rheumatoid arthritis can destroy the joint surface entirely. Whatever the cause, the result is the same. The joint no longer glides, and life begins to shrink around your pain. Section 2. The best reasons to get a total hip replacement. Here are the clearest signs that it may be time to stop waiting and start reclaiming your quality of life. #1, persistent pain that doesn't go away. If your hip hurts when you walk, stand, or even sit still, and especially if it wakes you up at night, that's your body telling you it's time to act. #2, you've tried everything else. Physical therapy, anti-inflammatories, activity modification, injections are all worth trying first. But when those measures stop helping, replacement becomes the next logical and most effective step. #3, your pain is limiting your life. When you stop doing things you love because of your hip, that's the moment it's no longer about the pain. It's about the quality of life you have. #4, you're losing mobility or stability. Sometimes your hip will actually begin to give way. When this happens, you're actually a risk to fall and break something. Maybe your hip, maybe your wrist. Either way, when you are a danger to yourself or your safety, then surgery is an option. #5, imaging and symptoms align. When x-rays show advanced degeneration and your symptoms match, there's no longer a reason to wait. However, sometimes the x-rays will underestimate the amount of arthritis. In those cases, an MRI will show the real status of the hip. For example, I've seen many patients that have a very good-looking x-ray, like almost normal. I've even been known to tell them that they have a hip of a 20-year-old. Then, when the MRI comes back, there's a lot of degeneration matching that to the patient, and that means it's time for surgery. The solution is mechanical, and surgery restores that kinematics. Still wondering if hip replacement might be right for you? Drop a comment below. I'd love to hear your story or answer your questions personally. And if you're looking for clarity, take our free 2-minute joint pain quiz. It's a quick, helpful way to see if surgery might be the right next step. Whether you're in Austin or traveling from across the country, we're here to help you make confident, informed decisions about your care every step of the way. Section 3, who's a good candidate and who isn't? A good candidate for a hip replacement is someone who has osteoarthritis, avascular necrosis, or post-traumatic arthritis. In other words, they have the disease. They've tried all the non-surgical options without lasting relief, is medically optimized and ready for a smooth recovery, and is mentally motivated and ready to be fixed. Patients who need to pause before surgery include those with uncontrolled diabetes, active smokers, or anyone whose medical condition increases surgical risk, because safety comes first. That's part of what makes the TDG Concierge model unique. We take the time to get you ready. From preoperative optimization to recovery logistics, every step is designed completely around you, not a hospital system. Section 4, why hip replacement changes everything. Of all the surgeries we perform, total hip replacement has the single greatest impact on a person's quality of life. With severe hip arthritis, there's no comfortable position. Standing hurts, sitting hurts, Even lying down can be unbearable. After surgery, that pain, that deep, grinding ache that's been controlling your life is often gone the moment you wake up. It's almost like flipping off a switch. Patients take one step and say, "Doc, you got it." Not to minimize surgical pain, but that pain is completely different from the preoperative arthritic pain. And because of the advances in modern, minimally invasive techniques, particularly the anterior approach, recovery is faster, muscle disruption is minimal, and patients are walking within just hours. You sleep comfortably that first night. The goal isn't just to take away the pain, it's to restore function. When you can move again, your posture improves, your back pain resolves, and you regain confidence in your body. That's what I love most about this procedure. It gives people back their life. Section 5. Age doesn't define readiness anymore. Years ago, we told patients to wait until 65. That was based on older implant designs that didn't last as long. Today, that's outdated advice. Modern implants should last indefinitely. In other words, the way a total hip can fail is different than it used to be. Gone are the days of the implant wearing out. If it fails, it will be because of a catastrophic problem. It could be because of a fracture, an infection, or even a dislocation. Hopefully, you'll never need a revision, but with modern revision techniques, even those revisions can be done as outpatient surgery. I've performed hip replacements in people as young as 13 and as old as 102. What matters most isn't your age, it's your readiness to live without pain. If your hip is holding you back from living the life you deserve, it's time to start having a conversation, not delay it. Section 6. Freedom, function, and a bigger picture. Hip replacement isn't just about removing the pain, it's about restoring freedom. When your hip moves smoothly again, your entire body recalibrates. You walk taller, you move more naturally, you sleep better, you start thinking about what's next, not what hurts. That's what I call transformational medicine. Because the goal isn't just to fix a joint, it's to give you back your ability to live life fully. If you've been living with hip pain and you're wondering if surgery might be the right step, know this: you're not alone. And there's a path forward. Here in Austin, Texas, I see patients from across the country and even around the world who travel to restore their mobility through precision hip and knee reconstruction. No matter where you're starting from, we meet you where you are with clarity, care, and world-class results.